But today we really want to focus on the importance of what our seniors need to know and what could happen if they sign up for a Medicare Advantage plan. So with that, I'll turn it over to Ivan Mitchell from Great Plains Health in North Platte to be our first speaker. Go ahead, Ivan.
I'm really happy to be here and talk about this this topic and this situation. It's been one that's become more burdensome, and as Jeremy just illustrated the results that we've seen from our NHA survey, you can see that just about every hospital is dealing with this. I'll share one story that that really stood out in my mind. We had a Medicare Advantage beneficiary who was living a very healthy life and ended up getting a pretty severe sickness, came into our hospital, was intubated for a little while, but recovered. And due to the intubation and this patient needed some rehab care. And under traditional Medicare guidelines, this patient qualified to go to a rehabilitation hospital. And there are two of those in our state. One that is Madonna, that's very well known. The other one is Select Specialty in Lincoln. And this was a situation where both of those facilities had the ability to accept this patient, said that they did meet traditional Medicare guidelines. But to get this patient transferred from our acute care hospital to a rehab hospital, we had to go through the prior authorization process. We went through multiple denials, and then as you go through the denial process, your next appeal is to do what's called a peer-to-peer evaluation. And so that is when our physician gets on the online with another physician from the large insurance company. These peer-to-peer evaluations were denied. We ended up appealing those 4 times, doing 4 different peer-to-peer appeals. And of course, these peer-to-peer appeals are only done between 8 and 5, Monday through Friday. This physician in particular has a large clinical practice they run. And during one of these peer-to-peers, this physician sat on hold for 30 minutes, delaying the care of all of the patients that he had to see that day. So it was a very frustrating situation. And when these situations arise, the people that these patients and these family members speak to are us. And they're angry with these situations. You remember the administrator on call at that time speaking with the son of the patient. And just very frustrated and very angry, saying that they told him it was just like traditional Medicare. And the guidelines for Medicare Advantage plans are that they are supposed to follow traditional Medicare guidelines. And if they did, that patient would have gone to Madonna, would have been in a rehabilitation hospital. This patient ended up spending 6 unnecessary weeks in our hospital. And it's very frustrating right now because we do have a shortage of healthcare workers. Jeremy mentioned the amount of patients who have been in an acute care hospital over 1 week unnecessarily. We are required by law to provide a safe and appropriate discharge. If these people cannot go home or go through home health, if that's not safe and appropriate, we have to wait until they get to a rehabilitation hospital, to a skilled nursing facility. So we end up holding on to these patients. And this one patient, for example, during those 6 weeks, we could have treated 10 additional acute care patients based on our standard length of stay. And we have been in a situation, as many hospitals have been, with the shortage of healthcare workers, where we are turning patients away, and those patients and family members in a place like North Platte, they have to travel about 100 miles to go to the next closest hospital that provides the specialty care that we do. That becomes very burdensome for the families, for the patients, and they don't have their support network that they can be with during their time to recover. And so that's just one example. It's a bit of an extreme one, but we do see our current data with our length of stay. It's about 25 to 50% longer with Medicare Advantage patients versus traditional Medicare patients, and that's due to the prior authorization. And not only that, when you have traditional Medicare, there is a set criteria. We have to meet medical necessity to care for someone. The skilled nursing facility has to verify that they meet medical necessity. But what will happen with a traditional Medicare patient is they'll be approved for up to 20 days to go to a skilled nursing facility to kind of rehab the sickness that they had. Our average patient that leaves here stays about 13 days. But what happens is once we get a Medicare Advantage prior authorization, they may only approve 5 to 7 days. So we use a bunch of resources, and the administrative burden is pretty drastic to get that prior authorization to go to a skilled nursing facility that is not required when someone has traditional Medicare. Then the skilled nursing facility, and we've seen them close throughout the state, they basically accept the patient, and then they have to start another prior authorization because that takes a couple of days to get more days than the 5 days or 7 days that are approved at the nursing home. And our nursing homes don't have the staff, they don't have the resources to do that as well. So this is an example. This is where we're really bottlenecking care and restricting care for the patients of our state. And this is due to the requirements for Medicare Advantage.